Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center reporting for the week of May 16, 2022. After a pandemic status update, I am going to respond to a question we are hearing a lot, which is that aren't we all going to get COVID anyway? What's the point of trying to avoid it if we're all just going to catch it anyway? So I'm going to do my best to answer this question. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Taking a look at total cases over the previous 14 days, we see that it continues this sloping up. Last week we were at about 5,500 cases for 14 days. Now we're over 7,000. And we know that this is a very significant undercounting given all the testing going on in homes. However, it's definitely going in the wrong direction. And same thing with the 7-day percent positivity rate. We were at 5.8% positive last week, now at 6.4%. And so we are going to be looking and hoping to see a peak and it coming back down soon. But so far, all of our indicators are heading up. Hospitalization, it's just slightly up from reporting last week. So it's just kind of hovering in this area here, although it is a bit higher. And we know that that's a lagging indicator, but really pleased to not see it skyrocketing. And this is likely due to a combination of vaccines and treatments. And so we'll continue to keep an eye on this because, of course, we don't know how high the cases are going to go, which means we really don't know how those other lagging indicators are going to do either. And we're really just doing everything we can to get our bearings around which direction cases are going. So we're having to look at a number of different indicators. One of them that I've been looking at is Oakland Unified School District because they have this great dashboard and they're doing a combination of routine screening. So it's not just people who have symptoms that are getting tested, but they're also doing screening. So this is a good thing to just keep an eye on to get a sense of how things are going. In the city of Oakland, last week when I reported, we had 1.7% positivity rate, and now we're at 2.6% positive tests for OUSD. So once again, another piece of data indicating that we are heading straight up. And at Roots testing site as well, our positivity rate from March to April has tripled, and we are watching it continue to tick up as we speak. And we know that this partly has to do with the new Omicron subvariant BA.2.12.1. It was at 37% last week nationwide, now at 43%, so it's just continuing to march its way on up, no end in sight there. And we know that it is even more contagious than the BA.2, and unfortunately, it is looking like people who had Omicron are still susceptible to catching this subvariant, even though they may have had protection from the original Omicron strain. And when we take a look at the CDC's maps, we can see that this is not just unique to this area. This is a phenomenon going on nationwide. Remember this map on the left, that's this lovely kind of soothing green color here. Really the only thing that this is telling us is that we've got enough beds in the hospital for you if you get sick with SARS-CoV-2 or anything else for that matter, which is a good thing. However, we see, first of all, up there in the Northeast, we have some concerns about our community levels, i.e. hospital capacity, the number of hospital beds. So that is very concerning that a part of our country is heading into that trouble zone. Also, as a reminder, we are very fortunate here in the Bay Area to never have run out of capacity. And we always had availability, so that's a great thing, but that's not the indicator we're going to use to tell ourselves that we're in a safety zone, because we know, unfortunately, we have already lost too many lives and had too many people get sick by this virus. So what we really want to know is what's on this map on the right, which unfortunately is a little bit harder on the CDC site to navigate to, but you can navigate cascade through to community transmission, and then you can look up by county, but you can see that much of the country is actually in a high transmission rate. There is an increase in the number of cases and the percent positivity. Things are on the rise in many, many places in the country. And when we hone in here on the state of California, we can see that the Bay Area is essentially all red in the high transmission zone. That includes Alameda County, Contra Costa, Santa Clara, San Francisco, Solano, San Mateo, Marin, all in the high transmission zone. And so for this reason, our 12 Bay Area county health officers got together and put out a release on Friday, this past Friday, 13th. And our press release states that daily reported cases in Alameda County have reached levels seen during the Delta wave. If you've chosen not to wear a mask indoors recently, now is a good time to start masking again. So solid advice there. It is reiterating the fact that masks are not required. However, they are strongly recommended, and they even pointed out a higher quality mask is a wise choice indoors and will help people protect their health. And a quote here from our health officer, Dr. Nicholas Moss: wearing a high quality mask indoors is one of the important layers of protection against the virus. Even with new variants, vaccines, masks, and available treatments continue to be effective in preventing the worst impacts of COVID-19. So this is important because no matter what variant we're talking about, a high quality filtration mask is going to help keep it out. We know it has to be well fitting, but it is certainly an important layer of protection. And so the question that we've been getting is, well, if this thing is so contagious, then isn't everybody just going to get it anyway? We've seen that type of narrative circulating around that somehow is indicating that maybe we should just accept that we're all going to get it. And so I'm going to do my best to answer this. This question could actually be answered in a number of different ways, so I'm going to take my best attempt at answering the question. And first, I'm going to start by what is the magnitude that we're even talking about here. So I'm going to talk about a MMWR report, Morbidity and Mortality Weekly Report. The link is in the post that was just published on April 29th, 2022. And it was taking a look at how many people have antibodies in order to understand what is the population level incidence of COVID-19. So how much what we call seroprevalence. So when we look at the blood, how many people actually have antibodies against COVID-19? So what they did was they took data from the CDC's commercial laboratory, their national commercial laboratory, and they also looked at American Community Survey data. And they used these data sets to basically examine trends of infection with SARS-CoV-2 to see about the seroprevalence, or the number of people who had it from September 2021 to February 2022. And it was tens of thousands of samples per month, somewhere around the 70,000 per month number of samples. So really amounting to hundreds of thousands of samples taken. And what they found was that there was a prevalence of about 33.5% of people who had it back in the September timeframe. By the time we got to February, after the Omicron wave, we were up to 57.7% of people who appear to have caught SARS-CoV-2. So 57.7% seroprevalence. So what we saw after that was a number of different headlines saying, well, most Americans have caught COVID at this point, as if, this was just sort of some normal or inevitable fact. And so the way I read it is, if 57.7% of people had it, that's still 42.3% of people who didn't. So 42.3% of people, roughly, and remember, this is sort of a population level kind of analysis. So obviously they didn't check everybody. but they did a robust enough analysis that I think if we say more than 40% of people never caught it, that's still a lot of people. And so I just wanted to start there with, let's not just throw up our hands and say, well, pretty much everyone's got it. Not true. Pretty much everyone hasn't caught it yet. More than 40% of people have not. And so I think that's really something for us to keep in mind. The other important thing to note is that, and this study was not able to determine whether people had caught it more than one time. So the other thing that ends up sort of being implied often is, well, I've already caught it. So people seem to think that if they've caught it once, they can't catch it again. And we know we're seeing increasingly evidence that that is absolutely not the case. There are people who have caught it 2 and 3 times, and there's really nothing per se that is going to completely prevent that from happening. So just because you caught it once also is not a reason to say, well, I can just go be careless, because every time you catch SARS-CoV-2, it is an opportunity for potentially a worse outcome, especially if any of the immune protection you have has worn off, as we know it does. So it can be worse. There's no evidence at this point that it's necessarily going to be worse, but there's also no evidence that it isn't or it couldn't be. So each time you catch SARS-CoV-2 is another opportunity for a poor outcome, and it's another opportunity for long COVID. And so what about long COVID? Well, there is a lot that we still don't know about long COVID. And one of the things that we don't know about long COVID, which is one of the reasons why it's still a major concern, is we don't even know the percentage of people that are going to catch it or get it after their SARS-CoV-2 resolves. And we don't have much data about whether treatments are going to improve it or not, or we really don't know the impact of treatments on long COVID, so we should not assume that taking medication is going to reduce the risk of long COVID. Estimates that we've seen are all over the place. We've seen estimates as high as 50%. Most of the estimates seem to be hovering somewhere in between 10% to 30% of people who catch SARS-CoV-2 will end up with long COVID. We don't know how long that's going to last. We certainly know that there are people who have had long COVID for years already, and we only have a couple of years to be working with. So there's still a lot to learn. But even if we took a pretty conservative estimate of 15% of people who caught SARS-CoV-2 ending up with long COVID, you can see here by this estimator, which the link to this is in the post, that we will be talking about over 1 million people in the state of California, almost 1.4 million people in the state of California with long COVID currently. So that's not even talking about more infections coming up. And remember, I'm using a little bit of a conservative estimate here. You can plug in whatever estimate you want there on the left. You can select whatever geography you want. And this is going to give you an estimate of the burden of long COVID within your community. And this is a lot of people. And this is very concerning because we already can see that it is leading to interruptions in daily living, interruptions in work and in functioning and disability. So anything that is sort of a potential mass disabling event, we really don't want to be just throwing up our hands and saying, well, who cares? We're all going to catch it anyway. Because the fact is, even if we're no longer really concerned about death per se, so if you're vaccinated, then you've already reduced your risk of death significantly. It's not eliminated, and certainly if you're at risk, being vaccinated, being fully vaccinated means also being up to date on your boosters. So as we sort of are heading into this 6th wave, it's a good time to see if you are up to date with your vaccines. If you're not, and especially if you are in the more vulnerable groups, if you're over 65, if you have underlying conditions, then we really want to be thinking about getting all the way boosted so that we can prevent from catching COVID. If you catching COVID, then you also obviously avoid long COVID. So I think the unknowns about long COVID, we don't know who's going to catch it. We can't tell ahead of time. It's not based on the severity of the infection. People who are vaccinated can get it. People who are treated presumably also can get it. We need more data on that. But I think even more concerning is we don't really get why it happens. We just don't know enough. And when you don't know enough, that's not the time to just play fast and loose with something. It's the time to really err on the side of caution. And I think we have a case in point when it comes to the next thing I want to discuss, which is children. Now, we know that from the beginning, the narrative was that children do fine, but tragically, we've already lost over 1,200 children in the United States from SARS-CoV-2 directly as a cause of SARS-CoV-2. So the acute illness killed them. 1,213 children have died from SARS-CoV-2. And for those who like to compare it to the flu, in that same time period, we lost 29 children from flu. So 1,213 children have died from SARS-CoV-2. In that same time period, 29 from flu. There's no comparison. And so we were wrong. We were wrong about it not affecting children. We were wrong. And unfortunately, a lot of that has led to really a lack of vigilance, in my opinion, on how we're protecting our children. Children have certainly been affected in more ways than one. We know that over 8,000 children have had MIS-C. That is the inflammatory condition, the multi-system condition that children can get. Over 8,000 of them have got them. A large percentage of those children will end up in the ICU. 68 of those children died from the MIS-C. And so these are all significant impacts on children. And we don't have a vaccine for our babies under 5. So in light of the fact that we are losing children from SARS-CoV-2, much of that has happened this year with the Omicron wave. So not even when we didn't have vaccines, but really in this last wave, much of our illness and death among children is actually worsening, and hospitalization as well. So the impact on children is worsening. And then we have this new situation on the scene, which is the severe hepatitis leading to liver failure in children. This has been a worldwide phenomenon that has been recently identified in multiple countries, the US, the UK, Israel, India, Japan. It actually was reported previously in India, but this particular outbreak has been signaled. The CDC has put out an advisory. From all that I can gather, we have about 450 children who've had this unexplained hepatitis worldwide so far. 26 of them have required a liver transplant. This is serious business. For a child to become a transplant patient at such a young age, and most of these children were sort of in that 10 and under age range, this is devastating. 12 of these children died. So we don't quite understand the connection, but naturally everyone has said, what other thing has affected individuals worldwide and caused organs to, unexplainably get inflamed and not work properly. So obviously people were making the connection. However, unfortunately and kind of shockingly, there has been what appears to be an attempt to downplay the role of SARS-CoV-2, and we are getting information sort of trickling in more from other countries than from the United States or the UK, who have seemingly been sort of trying to blame it on any number of things, from so-called lockdowns, which never really happened, to dogs, to adenovirus, which does not cause liver failure, at least that we've seen. It's very unusual. And there's been sort of a lack of vigilance on the part of trying to at least test these young people for COVID. Not that they have COVID right now, but did they recently? In Israel, there were some reports that what all of their children who had liver failure had in common was prior COVID infection 3 to 4 months earlier. Unfortunately, the CDC's advisory to healthcare providers is not asking us to check for SARS-CoV-2 antibodies or tissue biopsies for SARS-CoV-2. So I certainly hope that this is changing or will change soon, but right now I can just tell you that There is certainly a sense of unease about this situation, especially because the policies in the US and the UK really were to sort of let it run wild among children, with the notion that most children recover fine. So if it is indeed the fact that this is a later result that has anything to do with SARS-CoV-2, it may also have to do with adenovirus or another virus or an interplay between the two. We just don't know enough. But this article that I have linked to in the post, I thought was the first article that I saw coming out of the United States that seemed to be taking a balanced approach at acknowledging that COVID is a key suspect in severe hepatitis cases in kids worldwide. And I will certainly do a more thorough review of this once more information becomes available. But what we do know right now is 450 children with unexplained hepatitis, 26 required liver transplants. Their lives are forever altered. 12 of these children have died, and we still don't have a vaccine for children under 5. So another reason why we don't want to just throw up our hands and give up is because we still have a whole sector of our population, children under 5, that are by definition not protected, not vaccinated. So I think with a combination of what is unknown, there are still a number of us who have not caught SARS-CoV-2. I know many of us would like to keep it that way. I think many of us feel that, yes, we've put measures of protection in place, but we've still been living our lives. And so, yes, we will be living with SARS-CoV-2 for some time, but it doesn't mean we need to go out and catch it, especially not right now. And so what do I mean by that? Well, if you think about the last couple of years, our situation has dramatically changed. Every month or two, there's something new. So we have treatments now. We didn't have any not that long ago. And at one point, we only had injection treatments. Now we have pills. So I think we are learning more, we are getting more tools, and there will come a time, I believe that there will come a time when we will understand why long COVID is happening. We will understand if this liver failure is directly related to SARS-CoV-2. Hopefully, we'll even understand who's at greater risk of getting it than who isn't, and then we can put extra measures in place to protect those people. We will likely have treatments at some point. Right now, we don't have any treatment for long COVID. We're telling people to just pace themselves and treat the symptoms. We don't know how to treat the underlying cause because we don't really know what it is yet. So with this much unknown and this much uncertainty, we don't want to be taking unnecessary chances. But also with this field evolving as rapidly as it is, with so many scientists worldwide focusing on this, our picture will continue to look better in terms of the tools that we have at our disposal. As each month goes by, we'll have better information and we'll have better tools. So if I have to catch it, I'd rather catch it when we know more, when we have more, when there's more treatments. Maybe we're going to have a nasal spray that's a treatment, or a nasal spray vaccine as they're working on currently. Maybe we're going to have better ways to detect it and better ways to stop spread. But for right now, we're wanting to err on the side of caution because all of our tools really aren't all the way there yet. And ideally, hopefully, they will be. So you hear some people saying this is as good as it's going to get. I don't believe that for a second. I think we still have waves to get through. I think that we still have a lot to learn. But I think that if you have not caught SARS-CoV-2 yet, you're doing something right. Keep at it. Keep understanding your surroundings, keep understanding your personal risk, and keep understanding the risk of any events that you want to do. And on the note of events that you want to do, we are hearing still a lot of reports of post-graduation COVID outbreaks happening at proms and graduation parties and other events. And we are just really concerned, particularly about these multi-generational gatherings. And so we want people to really use the tools that you do have at your disposal and be cautious. We don't want your special event to turn into tragedy. And we know that when an outbreak happens at an event, that's all people really end up remembering about the event. So you might want to think to yourself, is it worth it? Is it going to be worth it? And if the answer is yes for yourself, that's one thing. Then make sure that you don't go on and spread it to someone who didn't make that choice, someone who's vulnerable. And so if you are going to be doing an event that's indoors, please assess the ventilation and how crowded it will be. Great time to make sure you're up to date on your vaccines, including your boosters. Make sure that you have enough of those KN95 or N95 masks in case you do need to go into a crowded or poorly ventilated environment. But also, let's say you do decide to go to that party, that event, then monitor yourself after that and keep yourself away from vulnerable people. Assume that you may have been exposed and wear an N95 around someone who's vulnerable. Test yourself maybe at day 3 and day 5, and maybe stay away from vulnerable people until you get that second negative test back. And certainly while you're at those events, we know that outdoors is much safer, and particularly eating and drinking outdoors whenever possible. So one thing that I wanted to mention about those tests, because I've been getting a lot of questions about this as well, is, well, what if it's still positive after my 5-day isolation? Can I go out at that point? And I really like this graphic here from Monroe County. I believe this is Indiana. If there's enough virus to detect, there's enough virus to infect. So I like that. If your rapid antigen test is testing positive, please assume that you are contagious. Unfortunately, the CDC guidance about only needing to isolate for 5 days fell short when it said nothing about testing to get out of isolation or wearing an N95 or anything of that sort. So after the 5 days, if you're still testing positive, if there's enough virus to detect, there's enough virus to infect. I think that those are good words to go by. And if you do test positive and you are in any vulnerable group, and remember that list is in the post of the conditions that make you high risk for poor outcomes, you'd be hard pressed to find someone on that doesn't land on that list, honestly. Because there's smokers, there's former smokers, there's behavioral health conditions, ADHD, diabetes, type 1 and type 2, cardiovascular issues. I mean, really, there's a whole lot of conditions on there. So if you're in doubt, please reach out to your primary care provider and get that prescription. And we've got Paxlovid. We've got the remdesivir for our little ones that are at high risk. It goes all the way down to 28 days. So if we've got little ones who are high risk, it's worth it to find out now where they would be able to get access to treatment. And hopefully we will be seeing in June is when the VRBPAC, is the FDA's committee, is going to be taking up the under 5 vaccines, as well as a potential booster for our 5 to 11-year-olds. So more protection will likely be on the way. So in closing, I would just want to say that cases are on the rise all around us, and there's still so much that we do not know or understand about this virus. So please continue to protect yourself. Gathering outdoors is going to be safer than indoors, or maybe you just want to take a break from gathering until we come down on the other side of this peak and get back to another lull. Hopefully you enjoyed doing some things during the lull, but our lull is basically over. So if you are going to still choose nonetheless to gather, outdoors is safer than indoors. Use a high filtration mask, especially if you're the only one doing it. So a well-fitting N95 or KN95. Spending a shorter time indoors is much safer than a longer time, so don't linger too long. And if you're in small spaces, please roll down some windows, open some doors, get some good ventilation going. Continue to be safe out there. Remember to eat a balanced diet, get some exercise, manage your stress, consider a multivitamin and vitamin D, and get a good night's sleep. Thank you so much for joining us. We will see you next Tuesday at 10 a.m. See you then.